Hi, I'm doing my IV administration video. So first we're going to refer to the MAR and the doctor's order. They match. Then we're going to do our first write after taking the medication out. Patient is generic, drug is cefazolin, dose is 1 gram, route IV. Time frequency is every 8 hours. For 48 hours, it's 8 o'clock now, so we're okay to give it. The expiry date on here is all good. And then we're administering this over 20 minutes as per the IV monograph. Reason is this is an antibiotic. They most likely have an infection. So I've double checked everything with the monograph here. Everything lines up, nothing of concern. I've done my medication calculations here if you want to take a look. So our rate is 300 milliliters an hour. Drip rate is 100 drops per minute. I'm going to be using a reconstitution device today, but otherwise I would have taken 5 milliliters out of the bag with a syringe, injected it into here, shook it up, and then put it back in. Okay, so let's take this off. Swab this 15-30 seconds, swab this 15-30 seconds. We'll get our reconstitution device. Okay, we'll give this a good shake. Make sure there's no lumps, clumps. May take a minute or so. Okay, that's good now. Okay, this might take a second here. I'm gonna make sure I try to get all of the medication in there. Okay, that's good enough. So we're gonna take this off. Sharps. Hang that on the side. Label that. I'm gonna throw all my garbage out here. Okay, that's garbage too. So I'll do my second check. Patient, generic, drug, cefazolin, dose 1 gram, route IV. Time, we're gonna administrate it over the course of 20 minutes. It's every 8 hours for 2 days. It's 8 o'clock, so we're good to give it. Reason, it's an antibiotic, most likely have an infection. So what I'm gonna do when I go into the patient's room is I'm gonna introduce myself, explain what I'm doing, get the patient's ID. I'm gonna flush the IV, prime my second line. So this would be new in a bag, and it would have a drop factor on the back, which would help us determine the drip rate here. So we're just assuming it's 20 because we don't have the bag. There would be a cap over this and a cap over that, which means they would be both sterile. I'm gonna take some alcohol swabs with me, my IV line label to put on this when I set it up, saline, the medication. I'll take all of this with me. Okay, we'll go over to the bedside. Like I said, introduce myself, explain the procedure. Check ID. Generic, yep, date's right. Okay, perfect. So raise the bed. First thing I'm gonna do is check their primary line. Normal saline, yep, that's correct. I'm gonna check for kinks, air bubbles, check the label here, that's good. Everything looks okay. I'm gonna go the whole way down. Okay, and I'm gonna check the IV side, everything looks good, no redness, no bleeding, no infection, no signs of infection, nothing like that. So next I'm gonna alcohol. Okay, and then I'm gonna flush the IV here. So I'm gonna clamp that really quick and clamp this. Okay. This might have a Curo cap on it, but it doesn't right now, so I'm just gonna swap that. Okay. Open that. Take this off. Or sorry, that would have been closed, then I would have opened it. And then that's on secure. I'm gonna push pause, and I want about 3 milliliters. At least. And on the last positive push, I close the clamp, unscrew, I'm done with that. So I can leave that line alone now. So next thing I want to do is get my secondary line, and then I'm going to prime that. I guess what I could do right now is lift this up, put it down lower, because the bag that you want to be administered needs to be higher. So again, looking at this line, this, like I said before, this would have a cap on it, and this would have a cap on it. There wouldn't be any bubbles. I would check this line, no kinks, no nothing. Alcohol swab this for 30 seconds. Again, that but it's supposed to have a cap on it. Connect it. And then I'm gonna open my line here. It's filling up, that's good. Close that, check for bubbles, no bubbles. Line looks good, okay. And then I'm gonna pop this off. And then keep in mind, this is sterile and that's sterile. There would be a cap on it, like I said. Pop that in there. Okay, that's in. So you want to hang this above the primary line. We've got our medication label there, and we're going to put our line label on it as well. Like that. Okay, next thing we would want to do, like I said, medication check. So the medication hasn't gone through yet. Patient, yes, correct. Generic drug, cefazolin, dose 1 gram. Root IV, time, frequency, every 8 hours, blah, blah, blah. Reason, it's an antibiotic. Okay, so here's where our medication calculations come in. I've done that. We've figured that out. Hourly rate, it would be 300 milliliters per hour. So if there was an Alaris pump, that's what I would put into the machine. But because we're just doing the IV line on its own, the drip rate would be 100 drops per minute. I'm not going to do that for the sake of the length of this video. But that's what it would be. So I would open this pump to 100 drops per minute. So we would figure out 100 drops per minute, all the lines are open. This medication is running, and like I said, 100 drops per minute over 20 minutes. And then once that's done, the bag will keep going. I'll come back in 20 minutes to check on it. I'll check the IV site again, make sure the medication's running through okay. And then double check with the patient that they understand what's going on. Lower the bed. Put all my tubing away so it's not in the way. make sure my patient is comfortable, document appropriately. I would document how the IV site looks, that I've checked all the lines, checked that I've compared it to the MAR, and I think that's, oh, and then obviously document on the MAR as well. And I would have a pen and I initial and then get another nurse to check it for me. And then another nurse would check there. Perfect.